Yes, I think so. After all, the tragedy of this pandemic, in terms of the lives lost, the education, the depression, the negative effects, even indebtedness of governments that'll take decades to work off, they are very pervasive. And so for a lot of countries, it's worse than gigantic war was. And so just in the same way that humanity takes other disasters like fire in a city or earthquake or war and says, okay, governments owe it to their citizens to be prepared. In this case, investments can be made. And what we saw during the pandemic is that a few countries, Australia's probably the best example, that were ready to roll out diagnostics and enforce some quarantine. They were able to stop the disease, and they've ended up with a death rate less than 10% of most of the other rich countries. So Australia, compared to, say, United States or most of Europe, that factor of 10 is a big deal. And so I think we have what we call positive exemplars. The foundation always likes to study, okay, where did things go the best, and try to see if that applies to other countries. So this idea of reacting quickly to get diagnostics and quarantine out, we have to have a global capability to see the disease coming. And then each country has to practice. I'm very big on the analogy to fire, where the fire department practices quite a bit. And so when a real fire comes, they're not sitting there saying, oh, what do we do? They know where the water is and where the resources are. And even the public's had some degree of training about, get out of the building, wait calmly. So it'd be stunning if the world didn't invest in being better prepared. Of course, the world is very distracted by many challenges, but this one deserves serious attention. Well, we're always subject to new variants coming along that could surprise us. And we have to be pretty humble about that, because we underestimated the risk of the variants, particularly Omicron, which when it came, had a level of transmissiveness that was much higher than the original virus. And so it's important to look all over the world and say, are the people at risk of severe disease and death, have they either been vaccinated or have they been infected? We believe, unless a variant totally surprises us, the people who've had, sort of one infection plus one vaccine, or, 2 to 3 vaccines, we believe that very few of those will get severe disease and death. And so, doubling down on getting the vaccine out to particularly the elderly, getting those coverage rates up, that's imperative. We saw sadly in Hong Kong, where their elderly vaccination rate was only about 35%, that Omicron is causing a wave of deaths there. They're getting some benefit from these therapeutics that have come along, but it's still kind of a tragic example. So, if a really bad variant doesn't come along, then countries that have the high vaccination rates really should see this more like they see flu. That is, it causes death. In local outbreaks, you would resume masks and some distancing, but you would not be shutting down the schools and the economy in any broad way, because just the death rate would be below what even a bad flu season looks like. Well, that's one area where the world did way better than we expected in advance, and it took even a little bit less than a year. And so, we had quite a bit of volume of vaccines. Within a year and a half, there'd been quite a bit of vaccination. So this time, we have to cut that time in half. That is challenging unless we have a platform like an mRNA or a particular approach where your risk of side effects and the new factory work you have to do is actually quite low. So if it does turn out that mRNA can be improved to have even better duration, that may be the platform that gets picked. And of course, the Gates Foundation will work with the Indian manufacturers to fund them and help them so they have deep expertise and capacity in whatever the pandemic platform is, which right now, that's most likely that's mRNA. Well, there's a lot of digital things that India is a leader on, and the Aadhaar identity system really helps with that a lot. It means that, of course, how do you identify somebody for their vaccine? Well, you use Aadhaar. What if somebody's pretending to have a vaccine certificate? Well, then their BioID is going to give them away. And so a few countries, that's one where Israel and India did a very good job, and other countries should learn from that because it means you don't have vaccine certificates. You can quickly look up if you're trying to enforce compliance on vaccines. Of course, those policies are complicated, but you have the tools to do it well and even understand, okay, which city is getting high rates? Are you getting the elderly as well as you should? India did target the elderly, and it's quite a good story. Our foundation helped Serum get going, and Serum and a few of the other vaccine manufacturers ramped up, in a very impressive way. Well, sadly, the Delta wave caught the world by surprise, and the Delta wave in India rose so quickly. I mean, even today, India has people move around a lot. India has multi-generational households. There's some things just because of the density of the urban areas that made India, at risk of that type of rise. But still, it's really incredible how quickly, and India, to its credit, actually saw that happening because it had enough testing capacity that there it was, and okay, very quickly measures were put in place to respond to that. The amount of Delta infection combined with the vaccination levels meant that India, at least so far, has not had a bad Omicron wave. Most of the bad effects of the epidemic came during that horrific, surprising Delta wave. Now India, should keep pushing on getting those vaccination rates up because there will be some Omicron outbreaks. Omicron's just so transmissive. I don't think it'll be gigantic, nothing like that big wave, but it's not completely over at this point. So, India has a lot to feel good about in terms of vaccines, digital systems, communications. Every country can say, I wish we'd done our good stuff even sooner than we did our good stuff. But, there's a lot to build on as we build this system to do even better when we face the next one. Yeah, so there's three investments that I put forward in the book to prevent the future pandemics. First is this global monitoring, which I call GERM. That actually is fairly inexpensive. That's like $1 billion a year and connected to the WHO. And that is the sort of central brain that's making sure we practice and rating everybody and having the data systems so that we catch outbreaks very early. The second is better tools. You know, the diagnostics, we need them to be cheaper, higher volume, easy to administer. And there's a lot of good ideas on those diagnostics, including diagnostics that we could use for normal years to detect the diseases that are out there. You know, we need better therapeutics. Those came way too late. And finally, we need vaccines that are easier to administer, like a patch or a aerosol, and vaccines that have more infection blocking and broader coverage. You know, and so that is a larger category, probably, 10 to 20 billion a year if you go across all the countries and the research they should do to make those new tools. The third category is the big one, that strengthen health systems. And there again, every country will have to look at, okay, what are its weaknesses? You know, could an outbreak fester without being noticed for like a month, and then the whole world would suffer because we wouldn't be getting ready and it would be spreading. And, particularly this is about respiratory diseases that we have to see any elevation and call in, expert resources. The overall cost of these three things, we're in the, 150 billion range over 5 years. So if you compare it to the cost we suffered, the 14 trillion, the ratio there is very favorable to buying this insurance policy, particularly because the things that I'm suggesting would have benefits. These better vaccines aren't just for the pandemic, they're also for malaria eradication and, tuberculosis and many other diseases, even the flu, where although we don't have pandemics, it causes a lot of sickness. And if we could have super good universal vaccines, we would try and get rid of flu from humans and all of the year-to-year burden, which is quite substantial. Well, probably the best way is to make within 6 months enough vaccines for the entire world. I don't think you can predict if you can't make that many. I don't think there's any avoiding the fact that the richer countries and the countries that have the vaccine factories are going to be slightly privileged over the poorer countries without vaccine factories. And so I think we have to, just make enough. In the case of this pandemic, the great inequity was actually that young people in any country got vaccinated before old people in every country. And so, some older South Africans weren't vaccinated when young people in the United States were being vaccinated. And so, once we understood the risk factors for the disease, we didn't do a good job on a global basis of getting the vaccines to the elderly, particularly as we realized the vaccines don't block transmission with Omicron. The benefits of vaccinating the young, it's still a positive benefit, but it's not a gigantic benefit, not even close to vaccinating the elderly. And that's a tough prioritization because vaccine systems, just aren't set up to focus on an age group. But, first of all, we should stop pandemics before we need vaccines for the whole world. If we need that many vaccines, then my book, my prediction of the book will have failed. That is, we'll be back in another pandemic. Fortunately, for many of these vaccine platforms, getting factories that have standby capacity to make a lot. If you say that, India becomes self-sufficient, China becomes self-sufficient, the West largely self-sufficient, that, each of those three big centers has to have enough extra capacity during their 6 months so that that you can offer vaccines to the entire world. Now, some people would say, hey, put vaccine factories everywhere, and that'll be debated, but the practicality of that in terms of the cost and the need for quality, I think, people who haven't worked much in the vaccine industry think it's easier to build vaccine factories than it is. Now, that's a very scary threat, and this book does not go through all the things you would want to do to block bioterrorism. And over time, bioterrorism gets scarier as the tools to create bad viruses is less something that only countries could do and more something that terrorist groups could do. Now, I will say that 100% of what the book recommends is necessary to be ready for that type of evil attack. But there are some even more sophisticated surveillance things, like in every airport, looking at water and air, and even sampling blood from time to time. And so it's a superset what we need to do, and I hope other authors go into that. But my book really focuses on naturally caused pandemics and preventing those from happening again. If a new pathogen with a high fatality rate got out and we didn't have therapies or vaccines, we would need to use lockdowns. Now, most respiratory pathogens don't have a high fatality rate, human-to-human transmissible. There are exceptions. Measles in a naive population, will kill, almost 20%. Smallpox in a naive population, would kill over 30%. So those are just extreme. And, now with COVID, the death rate is, somewhere between 0.2% and 0.4%. So this is not the worst case. And if you can isolate in a region of the world and not let it go global, then at least if you're having to do some lockdowns, it's very geographically constrained. We let this one get global before we were able to contain it. And, some countries, New Zealand, Australia, caught it before it was in 1% of their population. They still had to do some lockdowns, but way less than the United States or most of Europe did. Lockdowns are tricky, and, we should be studying them. If they make people move, it's tricky. There's many types of lockdowns and the ways that humans respond to lockdowns. A few governments can be extreme in enforcing lockdowns, primarily China. Other governments just can't do that. So whether it's good or bad, they have to be realistic about how well enforced, big lockdowns are going to be. Yeah, masks are pretty incredible. I talk in the book about getting some drug that would activate your immune system to reduce your rate of infection. And we'd have it stockpiled that it would work for any viral outbreak. But, you have to compare that to a mask. A mask is pretty cheap, easy to stockpile. I am surprised that people did get fatigued about wearing masks. So we had one country, Japan, where mask compliance was unbelievably high, because it's sort of viewed as a politeness to other people when you're in close proximity. And even during flu season, they're used to it. So they saved a lot of lives with masks. Now, sadly, in the United States, people are like, hey, this was painful. And, so the mask mandates are going away and mask use is going down. If you're unvaccinated, you actually need to wear a pretty sophisticated mask to make sure that you're not getting infected. If you're infected, then any mask reduces the number of people you infect by a lot. So masks are pretty magical and they don't have much downside. However, when humans are together, say drinking or eating, then you just tend to take the mask off. And we never solved that. So this antiviral drug, together with masks, hopefully will be available for next time. The case, we're going to get surprised, and in some cases we will have wished we'd put mask mandates on where there'll be local outbreaks. But to my surprise, people really do get fatigued of mask wearing.